Good afternoon, everybody, and welcome to the weekly Facebook Live. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management in St. Clair County. And as always,
I'm Dr. Annette Mercatante from the St. Clair County Health Department. Welcome back, everybody.
All right. So let's get right into the data like we always do. 18,197 total cases with 741 hospitalized, 404 deaths, and 677 recovered. In the last 7 days, we've had 251 cases, 35.9 average new cases per day. We're down to, just above 300 on the average number of tests per day, and we're currently at 7.7% positive. This is our trending, and we continue to go down ever so slightly. And we have not leveled off yet. So we'll be looking to continue to keep going down, and more to follow on that. As I said, our percent positive today is just above that 5% at 7.7%. And we're kind of holding steady for the last 3 weeks, which is good. This is our total vaccinations. There's been a significant drop this week in the first and second dose. So keep on getting your vaccines out there, everybody. Right now, we've got 106,277 total administered, while we're at over 125,000 for doses delivered to the county. Coverage for 12 and older is 44.4%, and for our 65 and older, doing really good at 70.0%. So this is a new slide that we're going to show from either time to time or every week. We haven't made that decision yet. But this shows with kind of a color code how areas of the county are doing with vaccinations. And so this is a really good metric for us. And then, as always, you can find out our up-to-date numbers on the dashboard at stclaircounty.org/offices/health/COVID19.aspx.
Yeah, I was just asking Brandon if we were going to put that vaccine map on. That vaccine map, I think, is a really compelling way of looking at. Remember, everybody want to know the cases in their neighborhood, because they thought that would give them an idea of how much risk there was. And I kept saying, no, the risk is when you go outside of your home and go places. But knowing what the immunity in your community is, I think is useful. And quite honestly, just to go back, green is good on that last thing, and pink, and the darker the pink you are, the worse. And if you notice, the rural areas are behind, and some of our poorer communities are behind, which is what we're seeing throughout the country. So this is where we want to focus some of our attention. Okay.
So that map now will be included on our weekly updates as well.
Mm-hmm.
That's really great.
Okay. Justin, you want to do some talking points just briefly on the governor's announcement today, or lack of?
Yeah, so I'm sure, thanks, Jen. I'm sure many people watched the governor today at 11:30, and we are all anxiously awaiting the new order that we expect on Monday at some point. It's a little too early right now to talk about all the things the governor said, because we don't have that official order in front of us. So we don't want to speculate on what could be happening versus what might not be happening. It's just a little too early for that. So we're just going to have to hang on through the weekend, and there'll be much more to follow Monday from the health department, as well as Thursday on our next Facebook Live.
Thanks, Justin. Okay, Doc, do you want to talk about our change with the scheduling our vaccine appointments?
Sure. So as you saw from that vaccine graph, seeing less and less individuals showing up at our large Knights Club clinic. That clinic was set up to do thousands of vaccines a day. And obviously we're not seeing nearly that much anymore. So it's time to regroup. It's time to shift to our next stage. And so we will be discontinuing. Let me read this right out to you. We will be discontinuing the Everbridge pre-registration system that you've been using for COVID-19 appointments tomorrow, Friday, May 21st. A final message will go out to everyone that's pre-registered. So if you're in the system, you will get a message about when your next vaccine opportunities are. But after tomorrow, you will not be able to use that system to register. On Monday, May 24th, we will have a new link up on the website that will allow people to self-schedule an appointment for COVID-19 vaccines. You'll be able to select the date and the time that works best for you instead of being assigned a date or time. So it kind of goes back to just kind of a normal process. So you go on our website, you click on the COVID-19 vaccine link, and you can select the date and the time. Those vaccines will be provided here at the St. Clair County Health Department. Now, there's also community clinics that will be going on throughout the county. So if you don't want to come here, you can go to our website and see the updated list of where other community clinics are being done. And we're going to continue to support and promote those clinics as well. So that's how you get your vaccine.
One more note I just want to add too is the testing that we've been doing in Marysville for a long time is also moving back here, effective June 1st. So vaccines for COVID and testing for COVID will come back to the health department and also be offered at our teen health center too.
Correct.
All right, questions.
And if you want,
questions from last night. Oh, go ahead, Doc. Sorry.
Well, I just want to say for the Teen Health Center, actually it's called Teen Health now. Jen,
yes.
Aging ourselves, Teen Health, sees individuals from the ages of, is it 10 or 12? I'm sorry, 12 to 26.
12 to 21.
And, right, 26.
For COVID, 12 to 21.
12 to 21.
Yep.
Okay, I'm sorry. So that center is also available for COVID. You need to call them to make an appointment. It's 987-1311, but that number is also on our website. So that one, if you want to go there for your vaccine and you're in the right age group, we want you to call and make that appointment directly, just like you would any other medical office. So go ahead. Go ahead.
Thank you. All right. So these are some questions that came through last night and then a couple this morning. The first question, Justin, can you please confirm there is a second dose clinic on May 27th at the nightclub? We will be transporting seniors on our bus.
Yes, there absolutely will be a second dose clinic on Thursday, May 27th at the Knights Club in Marysville.
Okay. Thank you. Yeah, we'll be at the nightclub one more week, Wednesday and Thursday. Okay, Doc. My 14-year-old granddaughter has her second COVID vaccine scheduled for June 7th. On June 8th, she has to get 4 teeth pulled and be put to sleep for that. Due to the anesthetic and possible antibiotics, should she reschedule that dental appointment for a later date?
So there's no real contraindication to her having that. But as you know, on day 2 of post-vaccine, day 1 to day 2 is when most people, if they're going to get a side effect from the vaccine, the body aches, the arm tenderness, but sometimes there can be fevers and chills and fatigue. Those generally occur in the 48 hours after the vaccine. So what I'd be concerned about is that you'd get a double whammy. If she's having she's having some of those post-vaccine symptoms, and then at the same time is getting the anesthesia and the teeth pulled, it just could double her discomfort. Okay. So I would talk to her dentist and see if maybe there is a different time you can reschedule, or reschedule her vaccine and do her vaccine after the dental work. I just, as a parent, I probably wouldn't double up the potential of being uncomfortable with both of those things at the same time.
Okay, thank you, Doc. All right, Justin, is it a HIPAA violation for a business to ask for vaccination status?
So surprisingly for many people, I bet, the answer is no. It in no way prohibits business owners and other individuals from asking if their employees have been vaccinated. When a business asks an employee or customer employees and customers, when a business asks an employee or customer for their vaccination status, and should you choose to say, I don't want to give it to you, then they have all the right in the world to deny you service under the current situation, right? Because we're in a public health crisis, and I believe at any other time, right, Doc? If you're a private business, you can decide who you want to let in your doors, And that
That's
would
how
be
I
the case
understand
here as
it too.
well. Right.
Right.
Okay. Next question. Any idea when all ages will be able to receive the vaccine?
So somebody did their research with this, although I've been hearing the same thing. It's likely, and this is according to Dr. Fauci, but I've heard this from other researchers as well. It's likely and almost certain that by the time we get to the end of the calendar year, so November or December of 2021, we will have enough information regarding the safety and efficacy, the effectiveness to be able to vaccinate children of any age. Now, that means we'll have enough information. It'll still have to go through the process of review and approval. So that process, as you know, can take a little time as well. But the answer is probably not any time this summer or this fall, but towards the end of 21 and beginning of 22, we should have a lot more information about that.
And I just want to give a shout out to Elise, who creates these questions and stuff for you guys.
She's a rock star. Yeah.
Thank you, Elise. Okay. Next question. Some medical professionals have told me that we are no longer have to wait 90 days after getting the monoclonal antibody to get the second dose of vaccine. Is this true or false?
Yeah, you just threw that at me, and I have not heard that. We do ask people to wait 90 days after monoclonals because the monoclonal antibodies stay in your bloodstream and could deactivate or reduce the effectiveness of the vaccine. And of course, that is in many cases partly theoretical because this is all kind of new, but that is true for other monoclonal antibody therapies and vaccines. So I will double check that and see if there's been a revision of those recommendations. But for now, if you've received a monoclonal antibody therapy for COVID, I would say you would still want to delay your vaccine process for 90 days for now. And we'll check that and talk to you again about it next week and make sure.
Both of you might want to chime in on this. Somebody asked, when do you think the pandemic will end and life will get back to normal?
You want to do that one first? I've been thinking about
Sure.
this one today because I saw that question. So how would you answer that one, Justin?
Yeah, so here's what I think. I think that we're going to continue to go through and hit these little gates, right? Not orders gates, but there's going to be pandemic recovery gates that we're going to continue to hit. And every once in a while, we're going to slip up and not hit one. So I think that the WHO will probably continue to call this a pandemic for maybe the next 6 months till the end of the year. And then after that, I think they'll reduce it to an epidemic and continue to kind of maneuver the same way that we have been, but just on smaller scales in hotspots around the country and around the world. That's what I think. But I think as we continue through the summer, you can expect that life both in Michigan and throughout the country will start to look a lot more normal than we have in the last year or so.
Yeah.
What are your thoughts?
And I would just say for the language, so I would say this virus is going to be considered endemic, meaning it is just going to be part of our portfolio of infectious diseases that we have to deal with. As we get better at dealing with this virus and we know more about it, hopefully we'll have more tools at our disposal. But I think we're going to continue to struggle with peaks and flows. I don't think the virus is going to disappear unless we work really, really hard at vaccine. And it took us 10 years plus, even more, for any of the other infectious diseases that we were able to kind of eliminate. So don't think that this is going to be, even the vaccine is going to happen overnight. But there is that glimmer of hope over the next decade that we won't have to worry about COVID. But I think we're going to have to, the word COVID-19 is going to be part of our vocabulary, certainly in the medical community, from the foreseeable future. Now, life as we know it, will it get better? I think this is all going to get better. But that doesn't mean you're not going to be at risk for getting infected and having to weigh those risks and benefits of what you have to do when we're having a surge of infections. I think vulnerable people are going to have to rethink what they're doing. And I think that's just going to be part of the process. And I think we're going to get used to it. And I think it's not going to feel so crazy overwhelming over time. I think it's going to become a new normal, if you will. That's going to be very tolerable and very functional and very easy for people to live with. But I don't think COVID's going to go away.
All right, thanks. And the last question that came through a little while ago, before we get to the live ones, is how many breakthrough cases in St. Clair County have there been following 2 vaccinations?
We know of 7, and we're investigating a handful of others. So these are, confirmed cases that come to our attention that we go into. So they're rare, but they are occurring, as we would expect. And so it's not, it's not a surprise that when you're vaccinated, fully vaccinated, you can't assume 100% immunity, right? Don't ever let your guard down that way. Jen, before we get into the live questions, can I answer the cortisone question? So we had a question last week that I kind of skirted a little bit because I wasn't 100%. So the question was, what is considered the amount of cortisone or corticosteroid treatment that would interfere with a vaccine? And the formal answers, we're not 100% sure, but generally use a cutoff of more than 20 milligrams a day for more than 14 days as an oral cortisone. So a single dose of steroid, an injection into your knee or a shot, that wouldn't be a contraindication, nor would an inhaled steroid or any kind of topical steroids. So the broad 20 milligrams per day, if you're a small person or a child, that would obviously be different. So that's the general thing. But the caveat with this is really the only true risk of steroid treatment during a vaccine is when we provide live vaccines. So that would be our MMR. Our measles, mumps, rubella vaccine, for instance. We only have a couple. COVID vaccines are not live vaccines. So it's not a contraindication to get a COVID vaccine, even if you're using steroids. What we don't know is how effective that vaccine might be. We're going to know more over time, but right now it's not 100% certain. So again, you go back to the risk of getting COVID disease versus, the benefit of the vaccine. Even if it's not fully effective, we would still advise vaccination for COVID, even with steroid use. But the issue with steroids does come up with live virus vaccines. We ask people to wait for those before they get those vaccines, but it doesn't apply to the COVID vaccine. So I hope that's more helpful than the answer I gave.
Right. And Bonnie had asked that again today. So thanks for following up on that.
You're welcome. And if I didn't specifically answer your question again, put it into the COVID-19 and I can be maybe a little bit more specific for what you're looking for. Okay.
Nikki had asked, where can 12-year-olds get a COVID shot after this week? And someone from our staff had answered the Harvey Reinvestment Center is offering that. But I also wanted to also say that there's also some pharmacies that are offering the Pfizer vaccine. And we had called around this week here at the health department and asked, and I guess Rite Aid Pharmacy, Meyer Pharmacy, Walgreens, CVS, Kroger, and Walmart all are offering the Pfizer. So what I would suggest is to also call before you go.
And what school are we at next week as well? We're at a couple schools next week too, aren't we?
I can't think.
I threw you under the bus there.
Sorry.
Okay. Well, there's that list on our website.
East China. I think it's East China and Porter on
maybe Algonac. Is it? Okay. I'm sorry, but we do have a couple school-based clinics as well. And those are on our list as well on our website. So
yes,
keep looking. It shouldn't be hard to find.
Okay. Let's see. What's the next question? Oh, so Mandy says, I don't have a question, but I just wanted to say thank you for all that you do. My husband and I got our second vaccine today, and everyone has been so nice and answered our questions. And the therapy dogs have been a great addition. So that was nice.
Getting vaccinated, I have to say, and thank you for that. But I had dinner with some friends last night, and they're vaccinated, and we're vaccinated. And I saw them, and I gave them a big hug, and we had dinner, and it felt so good there are so many advantages to being vaccinated. So I just want to encourage those of you that are kind of holding back. Boy, talk about getting back to normal, right? If there is a way to get back to normal for you, your personal life, that would be one, is to get your vaccine. Feels great.
All right, Linda asked, do we need to get our second dose at the same location as the first?
I'll take that one. So no, not necessarily. You should get it at the first opportunity, wherever that is. If you got your first dose somewhere else, you should let them know that you've been fully vaccinated so that they take you off their list and they can account for you. Especially if you're coming to a health department ran clinic, you should definitely just let us know on COVID-19 at stclaircounty.org, and we'll pull you off the list.
Well, it helps with planning for the size of the clinics. Yep. Now, at the beginning, we had only so many second doses and and it was more of an issue. But now we have plenty of vaccine for anyone, so there wouldn't be any issue if you ended up going somewhere else for your vaccine. I'm sure you could get it. But Justin's right. It's kind of nice to notify the clinic that's expecting you back, because then they can adjust their schedule.
And Jen, I know you're about to go to the breakthrough cases.
Yeah.
I did the math on that, and it's
okay.
0.00. It's 4 zeros and then a 6%. So, it's a very, very small amount of breakthrough cases we've had in the over 100,000 vaccinations we've done here in the county.
So do we know how many of those, have been hospitalized on those breakthroughs?
Yes. Less than 5.
Okay.
Yeah. Okay. So we have to say less than 5, because if we say 1, it indicates perhaps the identity of a person.
Yeah.
So it's less than 5. It's that many.
Okay.
Okay.
Elaine said she feels so much more relaxed since she received the vaccine. It's nice to see family and friends. Penny says, thank you for all you've done for everyone during this pandemic. Jan asked, any word about a booster for those of us vaccinated in January?
Not yet. As far as we can see, and this has been people are watching this very closely, every viral variant we have in this state still responds very well to the vaccines that we're using. So no concerns at this time for a need for a different vaccine, or even the same vaccine as a booster to boost our immune system. We'll hear more about that probably as the data comes in, and we'll let you know. But at this point, there are no active plans to provide boosters for anyone. We just really like to get the first set of vaccines in people's arms to a point where it'll provide some safety for our community. Boy, we're not even at 50% yet, people. So if you've been vaccinated, every person that's got vaccinated convinces one other person that it's worth it. That would help a lot. And so, your job, if you've been vaccinated and you're feeling good about yourself, as you should, try and convince one other person to come along with you. That will help a lot.
Okay. Kathy asks, does natural immunity from one strain protect against other strains?
We don't know. That's why this is one of the problems with natural immunity. There's just a lot we don't understand yet about our immune response to this virus and the variants. So more to come. I can't answer that question. I don't know. It would seem like probably there's some crossover immunity, but the coronavirus is a weird little virus. And that's been one of the concerns all along, is that that immunity may not be reliable. That's why we use 90 days of immunity post natural infection, and we're not using that time frame for the vaccine because we have a little bit more robust response when we get the vaccine.
Okay. And that looks like all the questions we have so far today. But I do want to plug one vaccine clinic, if that's okay. Saturday,
Sure.
May 22nd from 10 to 2, Bottoms Tri-Hospital EMS. that location is having a single dose Johnson & Johnson vaccine, no appointment needed, 18 and older. And it's a drive-through vaccine clinic at 5248 Horseshoe Trail. Just wanted to promote that because I know.
No questions about masks?
No, nothing.
Wow.
Do you want to say anything about mask before we say goodbye?
If you don't know who's around you and you're close enough to them within 6 feet for more than a fleeting moment or two, throw your mask on. I just would. My concern is this unmasking of the state is going to precipitate another surge. Quite honestly, I mean, that's our biggest concern. So for those of you who are unvaccinated, please, please, please be very careful when you go out, certainly when you're indoors. And even for those who are vaccinated, if you're in a situation that's kind of high risk and you just don't know who's there, masks they're safe. We're getting used to them. They're not even that bad, right? I mean, we all have a million of them everywhere. You got one in your purse, you got one in your pocket, you got one in your car. Just throw it on and just be careful. That's what I think.
Hey, Doc, we did have one last question come in. We still have time to answer that because it's not 4 yet. But Laura asked, first she says, thank you for all you've done. The adults in my family are fully vaccinated, but I have almost a 7-year-old grandson who is immunocompromised, so we're still being careful. Is there any more information on the risk of a vaccinated adult passing COVID on to an unvaccinated child?
Yeah, it's a really good question. The reason why the CDC kind of passed on its, forego the masks in a fully vaccinated person is there is more and more data on the value of being vaccinated and not shedding it asymptomatically to other people, not necessarily adult to kid, but I think just from an infected person to an uninfected person. I've believe some of those rates are as much as 70% reduction. It's not 100%. So again, if you have a very vulnerable kid, I would agree you're still going to need to be careful. But only remember, you can only shed it if you yourself are infected, and it's not likely that you yourself are going to get infected. So if you're fully vaccinated and feel sick, please go and get tested and consider that. But if you've been fully vaccinated, haven't been exposed to anybody that you can fathom is sick themselves, you're probably in a pretty good place. We're seeing a lot reassuring data on that. So good. And more to come. Cool. So actual numbers, I'm not sure of the exact number. I think it's too early to kind of predict but just remember, people, it's never 100%. Never, never, never. So the more vulnerable you are or your loved one is, the more you want to just keep that in mind. You don't want to be the one to bring that home and have something bad happen. It's just a terrible feeling. We've all experienced it now in the last 16, 18 months, but you just want to keep your guard up as best you can.
All right, Justin, any closing comments?
Yeah, so we talked about it a little bit, but clearly the light at the end of the tunnel is getting much, much brighter. And some of that, or a lot of that, is due in part to all the studies that have been going on, not only in the United States, but around the world. The epidemiologists and the people who are studying this are gathering data at light speed, and they're doing the best they can to put it all together. And I think we can appreciate the fruits of a lot of their labors as we continue to open up here in Michigan and throughout the world. That, like, we know India is still a hot spot. There's going to be trouble areas, and that's a little bit how this is going to go for the next, for the near future. But there's a lot to be hopeful for, and I just appreciate everybody's continued patience as we work through the nuances of this. And it is definitely brighter today in May of 2021 than it was in May of 2020. That's for sure.
Yay.
I would agree with Justin. And I hear from people, why should we believe any of this? Because it keeps changing. Well, it changes because we're smart, because as more information comes in, we change our mind. And I use that analogy, I think, a couple of times, you know, as a physician, if I saw an infection and I provided an antibiotic and the person came back a week later and I had more information, I had a culture back, or they came back and they weren't better, I changed my mind about what to use. That is good medicine. That's good common sense. And that's exactly what's happening in public health. As we learn more, we change our mind and shift. And it's sometimes hard to keep up. I agree, but that's the way this is going to go, I think, for a while. So hang in there. Use your head. Common sense, people. You don't need orders. You don't need laws and regulations to guide you on what you need to do to stay healthy, right? And remember, it's not just about your health. It's about the people around you as well. So you're doing a great job. Thanks, everyone.
Thanks.
See you next week.